We ready? Hi, I'm Dr. Robert Anderson, and we are getting ready to do a Kybella treatment for the submental fat, the double roll under the chin. We've already drawn the landmarks in here. This is the vertical midline. This lower drawing right here, mark, is the hyoid bone, and this is the upper limit of where we're going to inject. So we're just taking the fat out of this area right here. When I say we're taking it out, we're injecting the Kybella, and it's going to dissolve the fat. So the next step is to put a little temporary tattoo on here so that we get these spots in exactly the right place. So we're going to lay this right here, and then we're going to transfer the tattoo to the area. Peel this off, there should be a little tattoo there. Perfect. So you can see the tattoo. Now the little spots that are outside of our mark, we don't want to inadvertently inject those. So if there's a little tattooed area just outside of our marks, we take that off with a little alcohol. We don't want these up here. Sorry. So we have 1, 2, 3, 4, 5, 10, 15, 20, 25, 32. So we have 32 sites that we're going to inject. We're using a 32 gauge needle, which is truly the smallest little needle that we could put in that'll go through the skin. So we're going to start right here, go just under the skin, and put 2/10 of a cc in each site. Go right next to a little spot.
Doesn't hurt.
And that was Stephanie saying it doesn't hurt. She was not counseled to say that either. She did that of her own volition. It really doesn't hurt because this is such a fine needle, and we're putting such a small amount in each location that there's no real pressure from.
Hurts a little bit afterwards.
It's a little
fluid,
stinging.
but
This product is called deoxycholic acid, or it is deoxycholic acid. And deoxycholic acid is found in your body. It's in the gallbladder, and there it's used to dissolve fat so you can digest. So all we're doing is just using a natural substance that's already found in the body to treat some unwanted fat.
how long does it last?
This is permanent. Unless somebody gains weight, this fat's not going to come back. Turn your head a little bit toward me now. The thing I like about this is that the fat removal is much more uniform than what you would get with liposuction, and it doesn't create a lot of scar tissue like liposuction does. So you truly get a uniform removal of the fat. Because this is breaking the fat down, you are getting an inflammatory reaction here, and inflammation is characterized by redness, warmth, tenderness, swelling. So that's exactly what you'll see over the next couple of days.
Dr. Anderson, can you describe the perfect candidate for this procedure?
The question is, who's the perfect candidate for this procedure? And that would be somebody who has relatively firm skin under the chin, so an 80-year-old person would not be ideal. I'm just going to add a couple little over here. So you want somebody who's got an isolated fatty deposit in the neck, right here under the chin, basically your classic double chin, and you want skin that's going to be tight enough that it's going to retract back up. We normally, when this was studied, they were doing the injection every month, and they found that that was too soon. They were still getting some resolution of fat in the second month. So now we treat these every 2 months, and the usual course is about 2 to 4 treatments. And it really depends on how much fat is in there. We've had some that 1 treatment has been enough, and then there have been other people where 3 or 4 treatments is actually required. But it's really nice because we're done with the treatment. There's no downtime. She can go back to work. We'll wash all this off. We'll put a little blue ice pack on here with a little strap, and she can wear that at night when she's not at work. There'll be some swelling down here. It'll actually get a little bit maybe red. It'll feel warm, tender, a little bit tight. But we really haven't had any side effects or problems with this. It's a very well controlled product. It's called Kybella.
Can she apply an arnica gel patch to that?
She can. One of the other things is if somebody has scheduled this and they're anticipating doing this, they really should get off all anti-inflammatories like ibuprofen, an aspirin, a Aleve, that sort of thing. Green tea will make you bleed, fish oil, garlic, there's a lot of things. We have a complete list in the office. So after we see somebody in consultation, we'll provide that list of the products to stop taking for 10 to 14 days before we do this. And that's just to minimize bruising and swelling. It's not absolutely essential, but if you want a speedier recovery, if you can minimize bruising and swelling, that's ideal. How'd it feel? Not bad? Good.
Okay.
Any other questions?
No
So-
other questions. That's an Allergan Kybella treatment at Anderson Plastic Surgery and Med Spa. Thank you, Dr. Anderson.
You're welcome.